I did a pretty good podcast already on this subject many, many months ago, but it is probably the single most important evolution that has occurred in rhinoplasty in the last 5 years. And I want to discuss it again, as well as talk about some refinements in this concept. So this is the caudal septal extension graft. Essentially, it's a cartilage graft that is sutured to the septum on the bottom of the nose to support the nasal tip during rhinoplasty. The biggest reason to do this is that when you've opened a nose or when you've done anything to make a cut in the nose, you will lose tip support and the tip will fall. And in the old days, when I did a Collie-Meller strut, placing a small strut graft into the nose, the tip would fall even ever so slightly to dramatically over a week to a month, and it was very, very unreliable. And also, as we age, the nose also tends to drop or fall. The caudal septal extension graft is essentially taking a very mobile tip and securing it to an anchor point, fixed anchor point, which is the septum, so that the tip doesn't have that degree of imprecision. And I hate imprecision with rhinoplasty. It also secures that tip so over 5 years the nose doesn't collapse. And so if at 60 years of age, 20 years later, 30 years later, the nose should not collapse. Now, the nose does evolve over time, but the nose is so secured that it should not fall over time. Of course, there's no guarantees in life, but in general, that's the principle of what a caudal septal extension graft is. Gives you very, very firm anchoring. The other thing that the concept is besides tip stability, predictability, are some maneuvers that are very unique to a caudal septal extension graft. So with an Asian nose, the biggest concern is when you try to refine the tip, you tie the tips together and you rotate, then that'll cause rotation. If you do that, the nose tip will actually go upwards and look like a pig, which you want to avoid. So what the caudal septal extension graft does is allow you to create tip definition without undue rotation. In fact, you can rotate the nose however you want to rotate the nose because you have so much predictability in securing the tip to where the position should be. The other benefit, especially in broader ethnic noses, is since your anchor point now is fixed, it's strong, when you refine that nasal tip going forward, not only do you limit the risk of that nasal tip rotating when you tie the tips together, which is what you want to avoid, especially in ethnic noses, but also when you pull that tip forward, again, this is very hard to describe without a visual, but you actually secure the tip and it actually takes the convexity out of the side of the nose and it flattens it. It's called a lateral tensioning maneuver. You're actually pulling it forward and anchoring it so that the whole nostril sort of straightens out. You can't really get that effect, especially in weak ethnic nose cartilages, by just sort of tying it together or tying the tips together. You just cannot do that. With this, you're actually, with a fixed anchor point, you're actually creating incredible strength and recurvature or loss of that over convex side by pulling it to a fixed anchor point. So you can actually take the flare off a nose incredibly well with this technique. And along those lines, you can listen to my podcast on a lateral turn-in flap, where the old days when I had a bulbous nose, I would just cut out the extra cartilage, throw it away, and be done with it. The problem with that is you weaken the nose. And so what a lateral turn-in flap is, just as a quick summary, you score the cartilage, you fold the cartilage into itself, and that does several things. Now what you're doing is you're thinning the cartilage, but you're saving all that cartilage and is making it now much firmer. And then also what happens is that by flipping a convex piece of cartilage, it already flattens it. Now you take that move and you combine it with this caudal septal extension graft, which is causing this lateral tensioning anchor point, and now you've got an incredibly strong tip that is better shaped, defined, and predictable. So there's probably a billion other things I can talk about the caudal septal extension graft, but this is such an important concept that it is worth another podcast, especially if you missed my first one from a few months ago.